Good evening, everyone. I hope you can see and hear me. So let's first start with some of the questions asked in May in INICET. So the first question that was asked is, which of these is not formed from dental sac? Right, not formed from dental sac. So dental sac will form all the periodontium, right? So it will form the periodontal ligament, cementum, alveolar bone, but it will not form the pulp. Pulp is formed from dental papilla, right? Dental pulp is formed from. And next question, initiation of root formation and giving a definite shape to it is a function of. So the formation of the root and a proper shape, that is a single root or double root. So which of these basically is responsible for root formation? It is the Hertwig's epithelial root sheath, or HERS. Well, you cannot say whether diagrams will come or not in histology specifically, right? As I have seen from the last paper, they have asked generally the direct questions, right? And there hasn't been any diagram based question. But yes, we have discussed a lot of diagram based questions in our previous sessions. So let's first solve these questions that have been asked in May exam, right? So which of these forms a connection between basal epithelial cell and basal lamina? So basal epithelial cell, stratum basal, right? Stratum basal, and just beneath the stratum basal is lamina lucida, and beneath lamina lucida is the lamina densa, right? So lamina lucida, they are asking about the connection of stratum basal to the lamina lucida, and it is through the hemidesmosomal junctions, right? It is through the hemidesmosomal junctions. Clear? The connective tissue which is found beneath the lamina densa, this is the lamina densa, and here this is the lamina lucida. So the connection of lamina densa to the connective tissue is through the collagen fibers, right? It is through the collagen fibers. So there are anchoring fibers and there are chicken mesh fibers, right? There are chicken mesh fibers in the lamina densa, which is type 4, right? This is type 4. So type 4 fibers are found in lamina densa. Then there are anchoring fibrils, right? There are anchoring fibrils. These anchoring fibrils are type 7, and there are interlocking fibers. These fibers are type 1 and type 3, right? So these are the different fibers which help in establishing the junction between connective tissue and lamina densa, right? The next question that was asked is, the type of collagen found in dentine and bones is. So be it dentine, be it bones, be it PDL, everywhere it is the type 1 which forms the majority of collagen fibers, right? Next is, in the developing dental papillae, the zone of veil is the, actually it should be in the developing dental pulp, right? In the dental pulp. So in the dental pulp, you have the outermost, you have 4 zones, right? Let's say this is the dental pulp, and outside is the dentine, right? So let's say the outermost zone is the odontoblastic zone. It is the odontoblastic zone. Just beneath the odontoblastic zone is a cell-free zone. Cell-free zone, and this cell-free zone is called zone of veil, right? This cell-free zone is called zone of veil, and here you will find nerve plexus of Rashko, right? So the nerve plexus of Rashko is also found here, and there are nerves which have several branches on an average, one nerve will give approximately 8 branches, right? So here is a plexus of nerves. So the nerves are branching, right? They are branching and approximately 8 branches come out of each nerve. Then just beneath it is the cell-rich zone. The cell-rich zone mainly contains fibroblasts, right? The cell-rich zone is mainly contains fibroblasts, and then there is the core of the pulp. So core of the pulp, it has the large venules, the large arterioles, it has the undifferentiated cells, right? And the remaining, it also has cells associated with the blood vessels, right? So it mainly has undifferentiated cells, it has arterioles, and it has venules. So the large blood vessels, the large nerve trunks, and the undifferentiated cells, they are mainly found here. It does not mean that the fibroblasts or the different cells will not be found here. The fibroblasts, the different cells, they are also found here, right? Yes. So these are the 5 questions that have been asked from DADH in the May session of the INICET. Now, apart from this, I have some of my own MCQs. The thing is that if you consider the last 5 years of paper, that there are some topics that are important. So based on that, I have created some MCQs. They are quite easy, just to give you an idea of the topics that are commonly asked, right? So just for that reason, I have created these 10-15 MCQs. So let's go to the first question. Which tooth has the longest root in the human dentition? So actually they can ask you features comparing the features of the teeth, right? They can compare teeth, they can ask you features to compare different teeth, right? So which tooth has the longest root? Now as far as the length of the tooth is considered, or the dimension of the tooth, right, the apicocclusal dimension is concerned, the canines, that is the maxillary and mandibular, they are the longest teeth in the human dentition, right? They are both approximately 27 millimeters long. Just remember that the maxillary canine is a bit longer than the mandibular canine. Also, the root of the maxillary canine is longer and the crown of the mandibular canine is longer, right? So when the question is based on the crown, then it is the mandibular canine, and when it is about the root, then it is the maxillary canine. When it is the entire length of the tooth, then it is again maxillary canine, right? At what age does the first permanent tooth typically erupt? So at what age does the first permanent tooth typically erupts? The first permanent tooth is maxillary or mandibular first permanent molar. So the first permanent molar erupts at the age of about 6 years, right? It erupts at the age of about 6 years. That does not mean you will say 5 to 6 years. It is after 6 years, at least 6 years of age. So at least 6 years of age, ठीक है? तो 6 years of age तो होनी ही चाहिए, उसके बाद ही आएगा, 6 years से पहले नहीं आएगा. So which is the first succedaneous tooth to erupt? So another important topic here is the chronology, right? So which is the first succedaneous tooth to erupt? It is the lower central incisor, isn't it? The lower central incisor sometimes may erupt along with the first molars, that is at the age of about 6 to 7 or 7 to 8 years, right? Which of the following teeth is most likely to show a C-shaped canal configuration? So when you take a cross section, right? When you take a cross section, so in the cross section, one of the canals would appear as if it were C-shaped. So which of these teeth do you think will have a C-shaped canal? It can be a single rooted tooth, or it can be a double rooted tooth, or it can be a triple rooted tooth, right? So it could be any of these. So which one do you think has a C-shaped canal configuration? Options are maxillary first premolar, mandibular second, maxillary second premolar, maxillary second molar, and mandibular first premolar. So obviously, as you must have guessed from the diagram that I first drew, it has to be a mandibular molar, isn't it? And the answer is mandibular second molar. So sometimes they have asked this question, right? C-shaped configuration. So it is mandibular second molar. The primary distinguishing feature between a maxillary first and second premolar is, so the distinguishing feature between maxillary first and maxillary second premolar. Options are presence of a mesial groove. So mesial groove is present in upper 4 but not in upper 5, that is in the first premolar. So yes, it can be a distinguishing feature, right? Number of roots, again the number of roots in 4 is 2, isn't it? A buccal and a lingual, but in 5 it is only a single root, isn't it? So again it could be a distinguishing feature. Option number C, the size of the lingual cusp. The size of the lingual cusp is not much of a distinguishing feature because they are more or less of the same size, isn't it? The presence of a distal pit. The presence of a distal pit, the distal pit would be seen in both of these teeth, isn't it? It would be seen in both of these teeth. This is the marginal ridge and this is the central groove, let's say. So you will have a distal pit. You will have a distal pit on the distal side and a mesial pit on the mesial side. So both of these teeth will show mesial and distal pit, isn't it? Then what is the primary distinguishing feature amongst these two? That is option A and B. So you will notice that the mesial groove is a relatively less significant feature, or you will not notice it immediately. Which of these two will you notice immediately, right? Which is a macro feature and which is a micro feature. Macro and micro means which has a larger size, which is easily noticeable, which can easily help you distinguish between the two teeth in the first view, right? When you first look at the tooth, it will help you distinguish between the two. So it is the number of roots, right? It is the number of roots. Yes, the presence of mesial groove is a distinguishing feature. It is a characteristic feature of upper first premolar, but we have to distinguish between upper first and second premolars, and we will go for a feature that is macro, that is larger, that is easily visible, that can be looked, that you can see in the first look, right? So that's why it has to be number of roots rather than mesial groove. The primary function of oblique ridge in maxillary molars is, so the primary function of oblique ridge, so which cusps does the oblique ridge connect? The oblique ridge connects the mesiopalatal to distobuccal, isn't it? The oblique ridge connects the mesiopalatal to the distobuccal cusp. And what is the primary function? Options are to provide the strength or to strengthen the tooth, to support occlusion, to provide aesthetics, and to divide the tooth into lobes. So option D and C are obviously false. Has to be between option A and B. So supporting occlusion, well, the occlusion is also present in the first, second and third, all the molars and premolars, but nowhere else is the oblique ridge present to support the occlusion as such. So we will go with the to strengthen the tooth. This is the largest tooth, erupts first, has to be strongest, isn't it? Which muscle is primarily involved in mandibular protrusion? So mandibular protrusion. So mandible has to be protruded, that is moved forward or moved mesially. So mesial movement, basically lateral pterygoid, isn't it? Lateral pterygoid is the basic muscle. It is assisted by anterior fibers of temporalis, right? It is assisted by anterior fibers of temporalis, and also, if at all there is an option, zygomaticomandibular muscle. So what is this zygomaticomandibular muscle? So zygomaticomandibular muscle is nothing else but the deeper fibers of masseter, right? So these are the deeper fibers of masseter, and they assist in protrusion, or they assist the lateral pterygoid muscle. So two muscles will assist lateral pterygoid: anterior fibers of temporalis and deeper fibers of masseter. Along with that, also please note that the posterior fibers of temporalis are the only muscle fibers which help in retrusion of mandible, right? So retrusion of mandible entirely dependent on posterior fibers of temporalis. Clear? Which type of dentine is formed after the tooth has erupted and is a response to stimuli? So which type of dentine forms in response to some stimuli? And I hope it's easy to answer. It's the tertiary dentine. It forms after the tooth has erupted, right? And then there is some sort of noxious stimuli. So in response to that stimuli, either reparative or reactionary dentine will form. Reparative dentine from differentiated odontoblast-like cells, and reactionary dentine is from pre-existing odontoblasts. Clear? The predominant cell type found in the dental pulp. So as we have discussed previously, the different zones of the pulp. So based on that, can you tell me which is the predominant cell type? It has to be fibroblasts, right? It has to be fibroblasts. This is the predominant cell type in the pulp. But if asked what is the primary function of pulp, what is the primary function of pulp, then please don't answer nutrition or collagen formation or some other absurd answer. Please say that its primary function is to form dentine, right? Dentine formation is the primary purpose of the pulp, and for that reason sometimes it is called pulp dentine complex, right? The line of ridges in enamel corresponds to, so incremental lines of ridges, name itself is sufficient to get the correct answer, isn't it? Daily growth lines, developmental. Daily growth lines are process striations. Daily growth lines are process striations. These are weekly lines, isn't it? So these are the incremental growth lines, right? Next question. Tome's processes are associated with which cell type? So Tome's process, Tome's fiber, and Tome's granular layer. So these are the three features where this word Tome's is used, right? So Tome's processes are seen on ameloblasts on their distal end, right? On their distal end, or that is the end where the enamel is deposited. Tome's fiber is nothing but the odontoblastic process and is present on the odontoblasts. It extends into the dentinal tubule sometimes, isn't it? Tome's granular layer is seen at the periphery or subsurface of root, that is approximately 20 microns deep from the surface of the root, and these are formed by the looping or the bending or the branching of the dentinal tubules, isn't it? So Tome's granular layer is nothing but the dentinal tubules which loop or bend or branch, and they are seen subsurface, that is 20 microns from the surface of the root. Cementum differs from bone in that lacks blood vessels. Yes, bones have blood vessels, but cementum does not. Has a higher mineral content. No, cementum does not have a higher mineral content. Contains osteons. Osteons is a feature of bones. So again, this is false. Is resolved during orthodontic treatment. So cementum is not resolved during orthodontic treatment unless you have applied too much of force, isn't it? So basic difference would be it lacks blood vessels, and it is not as easy to resolve as bone. The neonatal line in enamel is an indication of. So neonatal line is another incremental line, and neonatal line is seen only in primaries and central incisor. Which central incisor? Mandibular or maxillary? Then you would say mandibular central incisor, right? So all the primaries, mandibular central incisor and maxillary and mandibular first molars. So it would be commonly seen in primaries along with the permanent first molars. Sometimes it will be seen in mandibular central incisor, right? So the options are tooth eruption, birth, trauma, fluorosis. So fluorosis भी नहीं है, trauma भी नहीं है, tooth eruption भी नहीं है, has to be birth. So only the teeth which have started to form before birth and continue to form after birth will show this neonatal line. So basically neonatal line represents the moment of birth. Interglobular dentine is commonly found in which area? Interglobular dentine, basically it is the lack of complete mineralization, right? Enamel में तो नहीं दिखेगा, pulp chamber में भी नहीं दिखेगा, has to be in the dentine. Dentine near the DJ or root apex. It will be dentine near the DEJ, that is it is seen in the circumpulpal dentine, right? Now from the name, please do not get confused that the name is circumpulpal, then how is it dentine near the DJ? The thing is that at the DJ, first of all, a small layer of mental dentine is formed, isn't it? A small layer of mental dentine is formed. How thick is the mental dentine? Approximately 15 to 20 microns, isn't it? And after this mental dentine, the next layer of dentine that is formed is called circumpulpal dentine. So majority of the primary dentine is formed by circumpulpal dentine, and just beneath it is the pulp initially, isn't it? But as the person ages or as the tooth ages, what happens is that the secondary dentine starts to deposit, isn't it? The secondary dentine starts to form. So it is the secondary dentine that is closer to the pulp, and the circumpulpal dentine is said to be closer to the DEJ. Clear? So please don't get confused by the names. Next question, Sharpie's fibers are a component of. So what are Sharpie's fibers? Sharpie's fibers are nothing but the PDL which is embedded where? Either in the bones or in the cementum, right? So either the PDL that is embedded in the bone or in the cementum is known as Sharpie's fiber. So enamel rods तो नहीं है, dentinal tubules भी नहीं है, pulp core भी नहीं है, has to be PDL, isn't it? The last question, the first sign of tooth development is the formation of. So first sign of tooth development क्या होगा? Dental lamina has to be formed, and this dental lamina will later on proliferate to form the bud, then cap, then bell stage, isn't it? So the formation of dental lamina is the first sign of tooth development. And when does the dental lamina form? It starts to form at the 7th week of intrauterine life and is well established at the 8th week of the intrauterine life. Is it clear? So can you tell me which of the two forms first? Is it the vestibular lamina or the dental lamina? The vestibular lamina is the first to form, right? The vestibular lamina is the first to form. It forms at around 7th week, and dental lamina forms at around 8th week. Clear? So these were a few MCQs that I created. Now let's go to some topics that I would like to discuss. Let's first see some. So can you once revise all genes in DH? See, that's exactly what I was planning to do, isn't it? So the genes associated with the tooth development and some additional information, right? So odontogenesis, some important points from odontogenesis. So sometimes they'll ask you which of the two components, that is epithelium or mesenchyme, has the earliest odontogenic potential, right? So which of the two has the odontogenic potential in the beginning? So in the beginning, before the establishment of the bud stage, right? So before the bud stage, that is dental lamina stage. Before that, even the primary epithelial band. So first of all, the primary epithelial band will establish. Then this primary epithelial band will proliferate to form the dental lamina and the vestibular lamina. So along these stages, it is the epithelium of the first pharyngeal arch that retains the odontogenic potential. So what it means is, if we take the epithelium of the first arch and you fuse it with the mesenchyme of any other region, be it let's say second arch, right? Second arch की epithelium ले लिया आपने, foot pad of mice कई बार books के अंदर example दिया रहता है, or any other mesenchyme you have taken, it would still result in the formation of a tooth, isn't it? It would still result in the formation of a tooth. So the epithelium has the odontogenic potential. After the bud stage to the early bell stage, right? Bud to early bell. Bud to early bell. So during this stage, it is the mesenchyme of first pharyngeal arch. It is the mesenchyme of the first pharyngeal arch that retains the odontogenic potential, right? So what it means is that, let's say you have taken the mesenchyme of incisor and you fuse it with the epithelium of molar, then what will be formed? Which tooth will form, incisor or molar? Since the mesenchyme has the odontogenic potential between bud to early bell stage, incisor will form, right? Now, at this stage, when the bud stage has been established, fusing mesenchyme, odontogenic mesenchyme with epithelium of other arches will not result in the formation of a tooth, right? You have to take the odontogenic epithelium. You have to take the epithelium of the first arch, right? That's why the example here is that of molar, right? Instead of second arch or third arch or something else, isn't it? So what happens in the late bell stage? What happens in the late bell stage? What happens in the late bell stage? In the late bell stage, the membrana preformativa is established now, isn't it? The membrana preformativa is established. The secondary enamel knots are already present, isn't it? What is the membrana preformativa? It is this basement membrane. It is the inner basement membrane. The inner basement membrane, that is the basement membrane supporting the inner enamel epithelial cells. So this is the membrana preformativa. And this membrana preformativa will now ultimately decide the shape of the tooth or decide the tooth type. So when I say shape of the tooth, isn't it morphologically decided that incisor will have a sharp edge, or canine will have a single cusp, or premolar will have two cusps, or molars will have 4 or 5 or 3 cusps, isn't it? So the membrana preformativa will ultimately, now what does the word ultimate means? Ultimate simply means at the end. तो ultimate का मतलब ये मत समझना कि हाँ भैया membrana preformativa ने जो कहा है वही होगा right from the beginning of odontogenesis, ऐसा नहीं है. Ultimately simply means that in the last stage, membrana preformativa is the deciding factor. So now if you fuse the epithelium, that is the enamel organ, this is the epithelial component, isn't it? So epithelial component of let's say molar with mesenchyme of, let's say, incisor. Now since the membrana preformativa is established, the tooth that will form is molar, right? Because the epithelial component we have taken from molar, the membrana preformativa we have taken from molar. Clear? So this was for the odontogenic potential. Sometimes questions from the odontogenic potential may be asked. Now let's go to the markers. जो भावना कह रही थी, markers of odontogenesis. So not all of these markers are important because I haven't seen most of these. Any question asked on most of these markers, some 2 or 3 they will ask, right? But still, since we have time, let's go through these. We have 4 different pathways, right? There are 4 pathways that control odontogenesis. So these 4 pathways will control odontogenesis. 3 are proliferative and 1 is inhibitory, right? So what does proliferative means? That means they will induce odontogenesis. And if any of these is overexpressed, it will result in supernumerary teeth, right? It will result in supernumerary teeth. BMP is an inhibitor. What it means is that it will inhibit odontogenesis. And if BMP is an excess, what it will do is agenesis or hypodontia or oligodontia or anodontia. So based on the extent of its overexpression, right? So basically BMP overexpression will result in less number of teeth. SGF, SHH and WNT overexpression will result in more number of teeth, right? So sometimes they'll ask you which is the earliest odontogenic marker. Which is the earliest odontogenic marker? Then earliest odontogenic markers are PIT-X2, FGF8, LHX and PAX9. So let's say this is the epithelium, and beneath the epithelium you have connective tissue or mesenchyme. So in the mesenchyme, LHX and PAX are expressed, and in the epithelium, PTEX and FGF8, PTEX2, LHX67, PX9, all these are expressed, right? So which genes are expressed first? Is it the epithelial genes or the mesenchymal genes? So which of these two will be expressed first? It is the epithelial genes. So first the epithelial genes are expressed, and then the FGF8 here, this will stimulate the expression of LHX6 and 7, and after that PX9 will be expressed, right? So first of all epithelial genes and then mesenchymal genes. Epithelial genes will stimulate the expression of mesenchymal genes. Now let's go to the individual genes. So first of all, FGF8. FGF8, that is fibroblast growth factor 8. It induces LHX in mesenchyme, as I just told you, and it helps in establishing the oral aboral axis. Now what is oral aboral axis? As I just shown, let's say this is the epithelium, and beneath the epithelium is the connective tissue. Now we have a tooth, isn't it? We have a tooth, and we have another tooth. So which one do you think has the correct axis? Which of these two has the proper orientation? Do you want the root erupting in the oral cavity or the root in the epithelium, or do you want crown erupting through the epithelium into the oral cavity? Which one should remain in towards the connective tissue? Which one should remain in the oral cavity? So the answer would be the crown should erupt into the oral cavity and the root should remain within the connective tissue. So this tooth A has the proper orientation, isn't it? Or you can say it has proper oral aboral axis. So the establishing of the oral aboral axis means correct positioning of the crown and root, right? So if the FGF8 is inhibited, just considering the oral aboral axis, what will happen? First of all, the tooth, they might get impacted because their orientation would be not properly aligned. Secondly, the teeth formation or the odontogenesis itself will get inhibited at the dental lamina stage. So tooth bud formation will not take place, right? Tooth bud will not form if FGF8 is inhibited. It is proliferative, as we have seen, isn't it? So we have SPRY2 and 4, these two genes we have, which are natural inhibitors of FGF8. So I haven't seen a question on SPRY2 or 4. So simply you can say that if something inhibits FGF8, what will happen? If it is natural, if it is normal, then it will prevent overexpression of FGF8, because you do not want FGF8 in more number. Why? Because as we have just seen, or as we have just discussed above here, if any of these are overexpressed, we will have supernumerarity. So we need to have normal number of teeth, the usual number of teeth, isn't it? So overexpression has to be inhibited. So natural inhibitor is SPRY2 and 4. They will maintain the proper amount of FGF8. So that is needed. We don't want SPRY2 and 4 to be absent totally. So if something inhibits SPRY2 and 4, what will happen? It will lead to supernumerary teeth. If SPRY2 and 4 are overexpressed, then FGF8 would be downregulated. And what will happen? We will have less number of teeth, because the tooth formation is inhibited at the dental lamina stage, isn't it? So we will have oligodontia or hypodontia or anodontia, right? Next is SHH, that is sonic hedgehog factor. SHH, full form कोई नहीं पूछेगा, just remember these short forms, right? SHH, again this is a proliferative gene, isn't it? And it is expressed in the epithelium just like the FGF8. It is inhibitor, the inhibitors of SHH will lead to overexpression. If the inhibitors of SHH are overexpressed, because SHH is proliferative, right? So if its inhibitors are in excess number, then SHH would be downregulated, and if it is downregulated, you will have oligodontia, hypodontia, right? And if SHH is induced in greater number, then there will be supernumerarity. तो कोई भी प्रोलिफरेटिव जीन हो, ज्यादा हुआ तो सुपरन्यूमररी, कम हुआ तो ओलिगोडोंटिया, or hypodontia. ठीक है, BMP2 and 4. This is the inhibitory gene. This is the only inhibitory pathway as we have discussed above, right? And it is expressed in the mesenchyme. तो अभी तक हमने तीन जीन्स पढ़े, FGF8, SHH, BMP2 and 4. FGF8 and SHH are epithelial. BMP2 and 4 are mesenchymal, right? They inhibit PAX9. PAX9 कैसा है? Just like SHH and PX, it is proliferative, right? And it also helps in patterning. PAX9 also helps in patterning. Now, what is patterning? Patterning is nothing but the formation of correct tooth at correct position, right? That is, if an incisor is formed, incisor should form in the anterior most region. If a molar is formed, it form in the posterior region, right? Canine should form behind the incisors. Premolar should form between canine and molars. So that is patterning, formation of the correct tooth at the correct location, right? So PX9 is the primary regulator of patterning. It is the primary regulator, and also this is a proliferative gene. So if PAX9 is overexpressed, you will have supernumerary teeth, and that's where BMP2 and 4 are helpful, right? So let's say these are the incisors, right? And then you have canine. So what happens is, you can say these are the dentate region, that is tooth bearing region, and the region between these teeth is the interdental region, isn't it? This is the interdental region. Now, do you want teeth in the interdental region, or do you want properly spaced and properly formed teeth, just 32 permanent teeth and just 20 primary teeth, isn't it? You want proper number of teeth properly placed, isn't it? So you don't want PAX9 expressing in this interdental region. So BMP2 and 4 will be expressed where? In the interdental region, so that PAX9 is regulated there, right? And PAX9 is expressed only in the dentate area. Tooth morphology induces P21. So P21 क्या होगा? P21 is the inhibitor of cell proliferation, and P21 leads to formation of enamel knot. So enamel knot क्या होगा? Tooth morphology decide करता है. I don't know whether you have read it or not, but enamel knot is also known as cuspal organizational center, right? It helps in the formation of cusp. Cusp form करता है enamel knot, right? And enamel knot को कौन differentiate होने में help करता है? This P21. So P21 is expressed in mesenchyme. Enamel knot is formed in epithelium. So again you have epithelial mesenchymal interaction. So P21 is an example of, or the induction of enamel knot by P21 is an example of epithelial mesenchymal interaction. Clear है? Overexpression of BMP2 and 4, what will happen? It will lead to formation of fused molars, right? It can also lead to formation of, not formation, but it can also lead to a condition known as hypodontia, oligodontia or anodontia. BMP का और भी रोल्स है जो हम आगे पढ़ेंगे, ठीक है? It also helps in teeth formation, specific teeth formation. So WNT is epithelial. So just like the other proliferative genes, FGF, SHH, WNT is also epithelial. This is also proliferative, and it is associated with continuous succession of teeth in some non-mammalian vertebrates. So in some animals, you see that there are not just two sets of teeth, but there are multiple sets of teeth. The teeth fall and they keep on coming, they keep on being replaced, right? So all thanks to WNT gene, right? It also induces LEF1 gene. This is also proliferative, right? This is also proliferative and one of the earliest gene. So can you tell me when is the earliest odontogenic marker can be, when is the earliest odontogenic marker seen? So the earliest odontogenic marker can be seen at the age of 9 days of intrauterine life, right? 9 days of intrauterine life, the earliest odontogenic markers can be seen. So which are the earliest odontogenic markers? We have already read about those. FITX2, FGF8, right? LHX 6 and 7 and PAX9, right? So genes associated with patterning, as I just told you what patterning is. Patterning is the formation of correct tooth at the correct location. तो डेंटल आर्च है तो इसमें इंसाइजर्स आगे फॉर्म होने चाहिए, मोलर्स पीछे फॉर्म होने चाहिए, राइट? दैट इज पैटर्निंग. नाउ पैक्स9 इज द प्राइमरी रेगुलेटर ऑफ पैटर्निंग, बट इस पैक्स9 को कौन रेगुलेट करता है? FGF8 तो इसे अप रेगुलेट करता है, और BMP2,4 इसे डाउन रेगुलेट करता है, दैट इज इनहिबिट करता है. तो डेंटेट एरिया में तो कौन मिलेगा? FGF8, और इंटरडेंटल एरिया में कौन मिलेगा? BMP2 and 4, and PAX9 is responsible for patterning. It is seen everywhere, right? So FGF8 also expressed in molar region, and it induces BARX1 gene. So BARX1 is molar specific. So if someone asks you which gene is molar specific, it is BARX1. The DLX2 is expressed in the distal segment. Distal segment means premolar and molar region. So DLX is responsible for distal segment. BARX is specifically responsible for molars, right? Now BMP2 and 4, these are also expressed in the incisor region, right? They are also expressed, as I have just told you, that they also help in the formation of specific teeth. So that is, they help in the formation of incisors. They stimulate or they help in expression of MSX1-2, and they are the inhibitors of BARX1. So MSX, M से क्या ले लेंगे हम? Mesial, right? So MSX gene is mesial specific, right? It is mesial specific. तो mesial teeth कौन से हैं? Incisors, canines, right? These are the mesial teeth. तो BMP क्या करता है? It helps in the expression of MSX1 and 2, so it helps in the formation of incisors and canines, and it inhibits BARX1, because BARX1 अगर express हुआ तो कौन सा दांत बनेगा? तो B, यहाँ से ले लो, B for big, right? B से big. So which is the biggest? Which are the biggest teeth? Molars. So BARX is associated with molars. So if BARX is expressed somewhere in the oral cavity, then molars will form, right? And we don't want molars in the anterior region. So that's why inhibition of BARX. PAX9 and MSX1, they also help in the differentiation of bud into cap stage, right? So the transition of bud to cap, it takes place with the help of PAX9 and MSX1. So these are some of the genes which help in patterning. Now let's go to the genes which are responsible for teeth morphology, right? Which help in the morphology or establishing the morphology of the teeth, right? So as I've already told you, MSX is mesial specific, right? MSX is mesial specific. So MSX1 and 2 are expressed in the region of incisors. Only MSX1 is expressed in the region of canine and premolar. So you can say that MSX1 overlaps in premolar region, and same thing you can say for DLX1 and 2. DLX though is a distal gene, right? It overlaps in canine region, right? As you can see, DLX1 and 2 are also expressed in molar region. They are expressed in premolar region, and then they overlap in canine region. Similarly, MSX1 and 2, they are expressed in incisors, but the MSX1 overlaps in premolar region. The ALX3, right? ALX3 is incisor specific, and similarly BARX1 is molar specific. It is the molar specific, and all these genes are mesenchymal. So all these genes responsible for the morphology of the tooth are mesenchymal. All the proliferative genes WNT, SHH, FGF were epithelial. The inhibitory gene, that is BMP, that was mesenchymal. Clear? So these are some of the genes on which questions can be asked, right? If you have any doubt, you can ask me. Do you have any doubt? Overexpression of proliferative gene will result in supernumerary teeth. Their suppression would result in oligodontia, hypodontia or anodontia. Similarly, overexpression of inhibitory gene उल्टा हो जाएगा, right? Overexpression of inhibitory gene will lead to what? It will lead to less number of teeth, and its suppression will lead to more number of teeth, right? So let's go to some distinguishing features and chronology of the permanent teeth. थोड़ा सा फटाफट से रिवाइज करेंगे, ठीक है ना, क्योंकि कभी कभी इस पे अप्लाइड क्वेश्चंस पूछ सकते हैं, राइट? So some teeth will be initiated in the first year of life, then second year of life, and then third year of life. So mostly all the primary teeth, also all the permanent teeth are initiated within the first 3 years of life. क्लियर है? तो फर्स्ट 3 years of life एक थर्ड मोलर को छोड़ देते हैं, थर्ड मोलर जो है वो एक्सेप्शन है, बाकी जितने भी दांत हैं वो सब फर्स्ट 3 years of life में इनिशिएट हो जाते हैं, राइट? सो विच टूथ इज इनिशिएटेड एट बर्थ? तो एट बर्थ की अगर हम बात करें, इट इज दी फर्स्ट मोलर, राइट? इट इज दी फर्स्ट मोलर, बी इट maxillary or mandibular, both will be initiated at the birth. Then in the first 5 months, तो यहाँ पर टेबल मैंने इसलिए दी है ताकि आप इसको देख भी सको, आप आराम से पढ़ भी सको, राइट? सो विच टीथ विल इनिशिएट इन द फर्स्ट 5 months? ऑल द एंटीरियर टीथ, राइट? ऑल एंटीरियर एक्सेप्ट अपर लैटरल, ठीक है? एक्सेप्ट अपर लैटरल, तो अपर लैटरल को छोड़ दो, बाकी जितने भी एंटीरियर्स हैं दे विल इनिशिएट इन द फर्स्ट 5 months ऑफ लाइफ. इंसाइजर्स विल इनिशिएट बिफोर कनाइंस, दैट यू कैन रिमेंबर, राइट? स्पेसिफिक डेट्स याद करना जरूरी नहीं है, राइट? व्हेन डज द lateral incisor initiate the upper lateral incisor? At the end of first year, at the end of first year, that is around 11 to 12 months. याद हो तो ठीक, नहीं हो तो भी ठीक. No one is going to ask you specific numbers because I don't think these numbers are easy to remember, ठीक है ना? तो बहुत ज़्यादा आजकल नहीं पूछते हैं, ठीक है? So which teeth will initiate in the second year of life? That is 1 to 2, है ना? 1.5 to 1.75 होगा, कुछ 1.75 to 2 होगा, ऐसा कुछ हो सकता है. So which teeth will be initiated in the second year of life? Now remember that all the anteriors are gone, the first molar is gone, so the 2 premolars and 2 molars are remaining, right? So only the first premolars will initiate in the second year of life. Is it clear? Only the first premolars will initiate in the second year of life. And as you can see, the maxillary premolar initiates at about 1.5 to 1.75 years, while the mandibular premolar initiates at about 1.25 to 2 years. So you may say that the maxillary premolar initiates a bit earlier as compared to the mandibular premolar, right? The maxillary premolar initiates a bit earlier as compared to the mandibular premolar. In the third year of life, the remaining teeth apart from the third molar. So apart from the third molar, now you have only just 2 teeth, isn't it? And which are these 2 teeth? 5 and 7. 5 and 7. Similarly, lower 5 and 7. So these 2 teeth will initiate in this third year of life. Obviously, 5 will initiate in the first half of the third year, and 7 will initiate in the second half of third year. So 2 to 2.5 years, second premolars, and 2.5 to 3 years, second molars. So as you can see here, 2.5 to 3 years, second molars, and 2 to 2.5 years, second premolars. Same thing will happen in the mandible, isn't it? 2 to 2.5 years, second premolar, and 2.5 to 3 years, second molars, right? So I think it's easy to remember, isn't it? So most of the teeth or all of the teeth will initiate in the first 3 years of life. First year में all the anteriors and the first molars, second year में only first premolar, third year में second premolar and second molar. Clear? Now the third molars, they will initiate between 7 to 10 years. So 7 to 9 maxillary and 8 to 10 mandibular. तो यहाँ पर भी maxillary पहले initiate हो रहा है mandible के comparison में, right? So as you can see, maxillary maxillary third molar 7 to 9 years, isn't it? Maxillary third molar 7 to 9 and mandibular third molar 8 to 10 years. तो मैंडिबुलर थोड़ा सा लेट है एज कंपेयर टू मैक्सिला। क्लियर? अब उसके बाद क्या आता है? क्राउन कंप्लीशन। तो हमने क्या देखा कि मोस्ट ऑफ दी टीथ इनिशिएटेड विद फर्स्ट, सेकेंड एंड थर्ड ईयर्स ऑफ लाइफ। कंप्लीशन की जब बात आती है तो हम वही थर्ड से शुरू कर लेंगे। तो 3, 4, 5, 6, 7 एंड 8, राइट? 3, 4, 5, 6, 7 एंड 8, दीज आर दी कंप्लीशन, क्राउन कंप्लीशन। तो सबसे पहले टूथ कौन कंप्लीट होगा? जो सबसे पहले इनिशिएट हुआ है एट द टाइम ऑफ बर्थ। कौन इनिशिएट हुआ? फर्स्ट मोलर्स। So the first molars complete when the second molars initiate. तो second molars कब initiate हो रहे हैं? 2.5 to 3 years. So this is the same time when the first molars will complete, right? इसके बाद कौन से complete होंगे? Anteriors. Anteriors में भी कौन से? जो छोटे हैं, that is incisors. So all incisors, right? All the incisors, as you can see here, upper central lateral and lower central lateral will complete in 4 to 5 years of age. राइट? इसके बाद कौन कंप्लीट होगा? इसके बाद वो टूथ कंप्लीट होगा जो स्टार्ट तो लेट हुआ है पर है छोटा। तो कनाइन बड़ा है या फर्स्ट प्रीमोलर बड़ा है? ऑब्वियसली कनाइन बड़ा है, isn't it? It has the largest root. It has the largest root, isn't it? 27 mm का टूथ है। तो फर्स्ट प्रीमोलर पहले कंप्लीट होगा एट द एज ऑफ 5 to 6 years। 3 पे फर्स्ट मोलर, 4 to 5 पे इंसाइजर्स, 5 to 6 पे फर्स्ट प्रीमोलर। सेम इज फॉर मैंडिबुलर, ये देख सकते हो यहाँ पर है ना, 5 to 6। नेक्स्ट 6 to 7 पे अगेन कौन सा होगा? कनाइन, जो बच गया हमारा इंटीरियर उसको ले लो, ठीक है? 6 to 7 पे कनाइन एंड सेकेंड प्रीमोलर, ठीक है? कनाइन एंड सेकेंड, सेम फॉर मैंडिबुलर एज वेल। एंड देन 7 to 8 पे आपका सेकेंड मोलर। सो मोस्ट ऑफ दी टीथ हो गए हमारे। इसके बाद आपका आता है थर्ड मोलर। तो थर्ड मोलर के लिए 12 to 16 years of age, right? Same would be for the mandibular, 12 to 16 years of age, right? Then next would be eruption. तो eruption में हमेशा ध्यान रखो, mandibular teeth will precede maxillary teeth, ठीक है? mandibular teeth जो है वो पहले आएंगे, maxillary बाद में आएंगे, except premolars. maxillary premolars precede mandibular premolars. So apart from premolars, all the mandibular teeth will erupt before their maxillary counterparts, right? तो अभी तुम यहाँ पर देख भी सकते हो। Along with the first molars, the mandibular central incisors erupt at the age of 6 to 7 years, right? फिर 7 to 8 years पे lower lateral and upper central ये एक साथ आ जाएंगे। lower central 6 to 7, upper central, lower lateral 7 to 8, then 8 to 9 पे upper lateral, right? So all the incisors and the first molars are established, right? इसके बाद क्या होगा? इसके बाद आएगा सबसे पहले मैंडिबुलर कनाइन, देन मैक्सिलरी फर्स्ट प्रीमोलर। तो सीक्वेंस क्या हो गई? अगर हम सीक्वेंस बनाएं तो सीक्वेंस क्या हो गई हमारी? सीक्वेंस हो गई हमारी अपर एंड लोअर 6, इसके बाद लोअर सेंट्रल, देन अपर सेंट्रल, लोअर लेटरल, देन अपर लेटरल, देन लोअर कनाइन, देन अपर फर्स्ट प्रीमोलर। क्लियर है? तो पहले अपर फर्स्ट प्रीमोलर आएगा, उसके बाद लोअर फर्स्ट प्रीमोलर, देन अपर सेकंड प्रीमोलर, देन लोअर सेकंड प्रीमोलर, देन अपर कनाइन। तो अपर कनाइन इज द लास्ट टू इरप्ट अमंग्स्ट द कनाइन्स एंड प्रीमोलर्स ऑफ बोथ द आर्चेस। तो जैसे कि आप यहाँ देख पा रहे हैं 7 to 8, 8 to 9 में आपका इंसाइजर्स वगैरह सब एस्टैब्लिश हो गए। इसके बाद नेक्स्ट आपका इरप्ट होता है लोअर कनाइन 9 to 10 में, 8 to 9 में अपर लेटरल, 9 to 10 लोअर कनाइन, एंड आफ्टर दैट you will have the upper first premolar, right? The upper first premolar at the age of 10 to 11 years, isn't it? 10 to 11 years. After that you will have lower central first premolar, right? So lower first premolar and upper second premolar both will erupt at the age of 10 to 12 years, right? 10 to 12 years. इन दोनों का एज सेम है। फिर उसके बाद lower 5 and upper 3, these both will erupt almost at the same time, 11 to 12 years. Again their age is same. तो एज रेंज जो है प्रीमोलर्स एंड कनाइन्स की, दैट इज समवेयर अराउंड 9 to 12 years, 9 to 12 years, right? तो 9 to 12 years में कनाइन्स एंड प्रीमोलर्स इरप्ट हो जाते हैं। ठीक है. After that, you will have the second premolars, and the second premolars are second molars are known as 13 years teeth. तो ये करीब करीब 13 साल की उम्र पे इरप्ट होते हैं. आप देखेंगे दोनों ही करीब करीब 13 साल की एज पे इरप्ट होंगे, एंड 17 to 21 पे थर्ड मोलर इरप्ट होंगे. For roots, just add 3 or 2 to 3, you can say add 2 to 3 to the eruption dates, and you will have the root formation dates. ये बहुत ज़्यादा इंपॉर्टेंट नहीं है. इसमें हमें इरप्शन, क्राउन कंप्लीशन, इनिशिएशन ये थोड़ा सा देखना था. ये मैंने आपको पहले ही बताया. ठीक है. एट बर्थ, फर्स्ट मोलर्स 5 months of age, all the anteriors except maxillary laterals. The maxillary lateral when the child is approximately 1 year old, right? तो क्रोनोलॉजी के लिए भी वही मैंने थोड़ा बहुत वापस से बता दिया था आपको. परमानेंट डेंटिशन इज कंप्लीटेड अबाउट 14 to 15 years. 13 years पे आपका सेकेंड मोलर्स इरप्ट हो जाते हैं. रूट कंप्लीट हो जाएगी अप्रोक्सीमेटली 15 to 16 years of age पे. तो बाय दैट टाइम परमानेंट डेंटिशन इज एस्टैब्लिश्ड एक्सेप्ट फॉर दी थर्ड मोलर्स. तो थर्ड मोलर्स अप्रोक्सीमेटली 18 to 25 years पे इरप्ट हो जाता है. अब यहाँ पर कुछ कंपैरेटिव, क्योंकि कस्प पे कई बार सवाल पूछ लेते हैं, साइज ऑफ द कस्प एंड which cusp would be sharper. So always remember that the supporting cusp is round and guiding cusp is sharp. ठीक है. तो मैक्सिला में तो शार्प, गाइडिंग कस्प कौन से हैं? बकल. सो बकल कस्प्स आर शार्पर एज कंपेयर टू द पैलेटल कस्प. मैंडिबल में बकल कस्प्स आर supporting and lingual cusps are guiding. So lingual cusps are sharper as compared to the buccal. तो यहाँ पर मैंने एक छोटा सा डायग्राम दिया है to explain the size of the teeth. So maxillary first molar, this is the permanent maxillary first molar, and mesiopalatal cusp is the sharpest, isn't it? Mesiopalatal cusp is the sharpest, and fifth cusp, that is the cusp of Carabelli, this is the smallest. क्योंकि distopalatal cusp is the secondary cusp. This is the secondary cusp. ये evolution में late appear हुआ है, right? That's why its size will decrease rapidly from first to second to third molar. And you will see that though the mesiopalatal remains the largest, the distopalatal becomes the smallest in maxillary second molar, right? In mandibular first molar, all the four cusps, mesiobuccal, mesiolingual, distobuccal, distolingual, are primary cusps, right? And that's why the same sequence will continue in first, second, and third molars. So mesiobuccal, mesiolingual, distolingual, and distobuccal. तो यही है सीक्वेंस कस्प्स के साइज का. सबसे छोटा कौन सा है? ये डिस्टल कस्प. Distal cusp is the smallest. Now, why do we call it distal cusp and not distopalatal or distobuccal? Why don't we call it distolingual or distobuccal cusp? इसको डिस्टोबक्कल कस्प क्यों कह रहे हैं? Why are we not calling it buccal cusp simply and this one distobuccal? Because the distobuccal cusp is not located on the buccal surface. In most of the cases, in majority of the cases, it is located on distal surface, and hence the name distal cusp. क्यों? क्योंकि ये distal surface पे है, ये medial ये buccal पे या lingual surface पे नहीं है, और इसीलिए commonly जो tooth की outline है, it would be described as pentagonal, right? That's why the common outline or the occlusal common outline would be pentagonal, right? In some cases, this cusp would be on the buccal surface. This cusp would be on the buccal surface. So if this is on the buccal surface, then its shape would change something like this, right? Its shape would change something like this if it comes on the buccal surface, and then it would become trapezoid. And if its size is insignificant, if the distal cusp has an insignificant size, then it would become rectangle. The shape of the tooth would become rectangle or square, whatever you want to call it, right? So the most common shape of mandibular first molar is pentagonal, followed by trapezoid, followed by rectangle. Clear? So here we have the primary molars, right? So this is the primary maxillary first molar. In the primary maxillary molars, in the permanent molars, maxillary molars, the mesiopalatal cusp was the largest. but in the primary maxillary molars it is the mesiobuccal cusp that is the largest. तो ये डिफरेंस है प्राइमरी और परमानेंट में. परमानेंट में mesiobuccal cusp was largest in the maxillary molars, but in primary it is the mesiobuccal cusp. ठीक है, mesiobuccal is the largest. यहाँ भी mesiobuccal is the largest and smallest in either cases would be distopalatal cusp. ठीक है, so apart from cusp of Carabelli, it is the distopalatal cusp that is smallest in primary maxillary molars, right? This is the mandibular first molar, primary mandibular first molar, and the mesial cusps are larger as compared to the distal cusps. Don't get confused by this diagram. ठीक है, इस डायग्राम में ऐसा लगेगा ये डिस्टल कस्प तो बहुत बड़ा है, ये डिस्टल कस्प तो बहुत बड़ा है ना, और mesial cusp छोटा सा है. So this is just the occlusal surface of the cusp. This entire thing is the cusp, isn't it? This entire thing is the cusp. Don't get confused by that. The occlusal table narrows in the mesial direction and it widens in the distal direction, but the size of the cusp is larger in the mesial, right? It's just that the mesial cusps are more convergent towards the occlusion and the distal cusps are a bit more divergent. That's the only difference, right? तो डिस्टल कस्प तो कैसे हैं, थोड़े से दूर है ओक्लूजन में, और मीजियल कस्प थोड़े से पास है ओक्लूजन में. दैट्स द ओनली डिफरेंस, राइट? तो mesiobuccal cusp is the largest and distolingual cusp is the smallest. तो सेम सीक्वेंस है maxillary and mandibular primary molars के लिए. Is it clear? This is the three cusp form of mandibular second premolar. Buccal cusp is the largest and distolingual cusp is the smallest. Clear? So ये कुछ इंडिविजुअल टीथ मैंने बताया लाया हूँ, इसमें ज़्यादा कुछ नहीं है. ठीक है, क्राउन टू रूट रेशो अगर हम बात करें, क्राउन टू रूट रेशो ये मैक्सिमम होता है मैक्सिलरी फर्स्ट मोलर का. तो ये कुछ फीचर्स हैं जो कि मैं आपको बता देता हूँ, है ना. क्राउन टू रूट रेशो इज मैक्सिमम फॉर मैक्सिलरी परमानेंट फर्स्ट मोलर. देन दिस सर्वाइकल डेप्थ, दिस सर्वाइकल कर्वेचर इज मैक्सिमम on the mesial side, on the mesial side of the maxillary first premolar. ये भी इसका मैक्सिमम है, right? Cingulum amongst the incisors it has the largest, but the most prominent is in the mandibular, lateral incisor. तो mandibular lateral incisor का cingulum prominent है, इसका central incisor का large है. But amongst all the interiors, the largest and the most prominent cingulum would be of maxillary canine, right? As you can see, its incisal edge is straight mesiodistally. The cingulum is a bit distally deviated. तो distally deviated cingulum कौन से हैं? जो distal हैं, upper one, lower 2, 3, and the cingulums which are absolutely in the center. The cingulums which are absolutely in the center, they are lower 1, upper 2, 3. So these are cingulums in the center. Cingulum in center. This is the most symmetrical crown. So lower central incisor has the most symmetrical crown. Its incisal angles are almost 90 degrees and the incisal contacts are almost at the same location. Is it clear? ज़्यादा कुछ इसमें नहीं पूछते हैं. ठीक है, ओवल शेप कह सकते हो, occlusal outline. Then you have the maxillary lateral incisor. Incisal edge slopes distally upwards, right? The tooth also appears to be twisted. The tooth also appears to be twisted towards the distal side. Clear? Mesial marginal ridge is always larger or longer as compared to the distal marginal ridge, but the distal cuspal ridge, as you can see, the distal cuspal ridge is longer as compared to the mesial cuspal ridge in the canine or any other tooth which has cusps. इसके दो ही exception हैं, upper C and upper 4. Here the mesial cusp ridge is longer than the distal cusp ridge. ठीक है, तो हम वापस आ जाते हैं lateral incisor पर. Lateral incisor, it shows maximum number of anomalies amongst all the interiors, right? So after the third molars, after third molars, after the third molars, upper and lower, it is the upper lateral incisor that shows the maximum number of anomalies, developmental anomalies. Most commonly missing teeth after third molar, it is the maxillary lateral incisor. क्लियर है? तो इसमें पैग शेप लेटरल आपने सुना होगा. उसके अलावा जो माइक्रोडोंशिया होता है वो बड़ा कॉमन होता है, राइट. इट ऑल्सो हैज अ स्पेसिफिक groove on its palatal surface, palatogingival groove or palatoradicular groove. This is again a developmental groove that is detrimental. Why is it detrimental? Because it accumulates plaque and is detrimental for the periodontal ligament. ठीक है. Now this is the mandibular lateral incisor. As you can see, it has a distal twist. The incisor edge has a slight distal slope. The distal angle is a bit rounded as compared to the medial angle. ये common features है जो हर जगह देखने को मिलेंगे आपको. Always remember that the incisor edge of the lower anterior incisors and canines is lingual to the bisector line. ठीक है. And in case of maxillary, the incisor edge is on the bisector line. ये कुछ एक फीचर्स आप देख सकते हैं. यहाँ पर रूट लेंथ इज मैक्सिमम अप्रोक्सीमेटली 17 mm, क्राउन इज 10 mm. In the maxillary, the crown length is maximum in the maxillary central incisor, right? So upper central incisor has maximum crown length. Canines, as I have already told you, it has most prominent crown features, be it cingulum, be it marginal ridges or the incisal ridges. They are all most prominent of all the anterior teeth, right? ये mandibular canine है. In mandibular canine, you would notice a specific feature that its labial surface is C-shaped. Some time back, we read about a C-shaped canal configuration which was seen in mandibular second molar. This is C-shape of the labial surface and it is seen in the mandibular canine. Also, you can note that the mesial outline is almost straight. Similar feature is also seen in mandibular deciduous first molar. Its mesial outline is also straight. Clear? As you can see, the mesial cusp ridge is almost straight. The mesial cusp ridge, which resembles the incisors. So mesial half of the mandibular canine resembles incisor, while the distal half resembles premolar or the posterior. तो ये कुछ स्पेसिफिक चीजें इसमें जो आप याद रख सकते हैं. नेक्स्ट आर प्रीमोलर्स. सो फर्स्ट ऑफ ऑल मैंडिबुलर प्रीमोलर्स, और ये बड़े यूनिक प्रीमोलर है. दिस इज दी मैंडिबुलर फर्स्ट प्रीमोलर. दिस इज दी स्मॉलेस्ट प्रीमोलर एंड एज यू कैन सी it has a developmental groove, right? It has a developmental groove. This is known as mesiolingual groove, right? Mesiolingual groove. This is a developmental groove, isn't it, between the lingual cusp and the mesial marginal ridge, or you can say it is between the lingual lobe and the mesiobuccal lobe. You know that the buccal surface is made up of 3 lobes and the lingual surface is made up of 1 lobe. So between the mesiolingual lobe and the lingual lobe, you will see this mesiolingual groove, right? And the developmental depressions here, they resemble the eye of a snake. They resemble the eyes of snake. So sometimes they may ask you, eyes of snake, like occlusal surface is seen on this tooth, which is the lower 4. That transverse ridge of lower first premolar is most prominent. As you can see here, this ridge is very prominent, isn't it? This ridge is very prominent. It is very, or you can say most prominent transverse ridge of all the teeth is seen in lower first premolar buccal cusp. क्लियर है? In all the posteriors, the marginal ridge is perpendicular to the long axis, but the mesial marginal ridge of lower first premolar is inclined at an angle of 45 degrees, right? Another feature, important feature, is that the tooth itself or the crown itself is twisted or is angulated. Let's say this is the long axis of the tooth. The crown itself appears to be inclined or bent on the root, and it makes an angle of approximately 30 degrees. So this is the most of any crown inclination. So amongst all the teeth, the maximum crown inclination is seen in lower first premolar, and it is about 30 degrees. तो ये क्वेश्चन भी कभी कभी पूछ लेते हैं आपसे, right? And the lingual cusp is like a cingulum, and as you can see, it lies outside the lingual boundary of the tooth, right? The cusp tip lies outside the lingual boundary of the tooth. The lingual cusp tip lies outside the lingual boundary of the tooth. ये second premolar आ गया. Second premolar, the cusp is rounder as compared to the first premolar. ये दोनों ही जगह होगा, maxilla में भी, mandible में भी. The sharpest premolar cusp would be of upper first premolar, right? More commonly, it has 3 cusps, though it can also have 2 cusps. But 3 cusp configuration is the commonly seen configuration. And here you have 2 lingual cusps, mesiolingual and distolingual. Mesiolingual would be larger, and then would have a lingual groove separating the lingual cusp, right? And here you can see it has variable central groove shape, variable shape of central groove. The central groove की shape कौन सी होती है? U, H, right? U shaped हो सकता है, H shaped हो सकता है, और U shaped हो सकता है and H shaped हो सकता है, right? और ये जैसा कि आपको यहाँ दिख रहा है Y shape, right? So these are the 3 configurations of the central groove that can be seen in second premolar, lower second premolar. Dens invaginatus. Dens invaginatus is commonly associated with lower second premolar. ठीक है? This is the maxillary first premolar. This is the commonly it is a 2-rooted tooth. This is commonly 2-rooted, right? 2-rooted premolar. The rest all the premolars have a single root. Here it has 2 roots. तो buccal root जैसा कि आप देख रहे हैं, it twists distally, and the lingual root is bending towards the mesial side, right? The lingual root bends towards the mesial, and the buccal root bends towards the distal side, right? Buccal root long है, lingual root short है. Mesial developmental groove which continues into the mesial developmental depression. यहाँ पर जैसा कि मैंने आपको बताया, distal cusp ridge is shorter as compared to the mesial cusp ridge, and that is the reason the buccal cusp appears a bit distally placed. So which tooth will show a distally placed buccal cusp? The answer would be upper first premolar. क्यों ऐसा होता है? क्योंकि mesial cusp ridge जो है वो long है as compared to the distal cusp ridge. तो आप यहाँ पर कंपेयर करोगे lingual और buccal cusp tip को, you will see that the lingual cusp tip is relatively mesially positioned in comparison to the buccal cusp, right? And as you can see, this is asymmetric tooth. यहाँ पर asymmetry दिखी ना हमको आराम से. This is the most symmetrical premolar, upper 5. Most symmetrical premolar. It has most numbers of supplemental grooves, and as you can see, it has a wrinkled appearance. It has a wrinkled appearance, isn't it? ऐसा लग रहा है बहुत सारे स्थल हैं इसके चेहरे पर, तो wrinkled appearance, right? Apart from that, इसमें ज़्यादा कुछ important है नहीं. जैसा कि आप यहाँ देख सकते हैं, lingual and buccal cusp, they are of almost same size, right? They are of almost same size. Next, the molars. So maxillary first molar, this is the largest tooth, right? This is the largest tooth. Which is the largest root? अगर कोई पूछे which is the largest root, then answer would be upper three. That is maxillary canine has the largest root, but the largest tooth is the maxillary first molar, which is the largest molar root. अगर ऐसा पूछें तो you will say it is the palatal root of maxillary first molar, right? That is the largest molar root, isn't it? Configuration जो buccal roots की है वो कैसी है? Like the handle of a plier, right? Like the handle of a plier, handles of the plier. Smallest root कौन सी है? Distobuccal. Largest root कौन सी है? Palatal. Palatal is largest and longest. क्राउन्स के कस्प्स के बारे में मैंने आपको बता ही दिया, कौन सा लार्जेस्ट है, कौन सा स्मॉलेस्ट है, शार्पर कौन से हैं, ब्लंट और राउंड कौन से हैं, राइट? तो यहाँ पर भी ज़्यादा कुछ है नहीं स्पेसिफिक. ऑल्सो यू विल नोटिस दैट रूट्स इन द फर्स्ट मोलर आर डाइवर्जेंट, बट इन द सेकेंड मोलर दे आर अ बिट कॉन्वर्जेंट. इन द थर्ड मोलर दे हैव ऑलरेडी fused, right? So as we go from first to second to third molars, the root divergence will decrease. They will become convergent, and in the third molars they might even fuse, right? You can see all the roots are diverging, or all the roots are bent in the distal direction. So most of the roots will bend in the distal direction. Sometimes they'll ask you which angle, which line angle in maxillary second molar has a 90-degree angulation. So it has a 90-degree angulation. So as you can see here, it is the distopalatal angle, which is approximately 90 degrees, right? So distopalatal angle is approximately 90 degrees. Here you can see the distopalatal angle है वो कैसा है? Almost acute. ठीक है? This is obtuse, this is obtuse, and these two are said to be acute, right? So mesiopalatal and distobuccal are said to be obtuse angles, and the remaining two, that is mesiobuccal and distopalatal, are said to be acute. But in the second molar, the distopalatal becomes 90 degrees, right? और इसमें ज़्यादा कुछ है नहीं. कस्प ऑफ कैरेबिली जो है वो एब्सेंट है इधर, राइट? थर्ड मोलर में जब हम जाएंगे तो यहाँ पर डिस्टोपैलेटल कस्प ही एब्सेंट है. डिस्टोपैलेटल कस्प जैसा मैंने आपको बताया, डिस्टोपैलेटल कस्प इट decreases drastically, or the size decreases drastically from first to third molar, since it is the secondary cusp, and here as you can see it is absent, right? So you can describe the shape of the tooth as heart shape, right? It is almost heart shape, two buccal and one lingual cusp. It does not mean that the number of lobes are less. It is still made up of 4 lobes, isn't it? All the second molars and third molars are made up of 4 lobes unless they have 5 cusps. All the teeth that have 5 cusps are made up of 5 lobes. So first molars तो सभी 5 lobes से बनी रहे हैं, second molars 4 lobes से, और third molars if they have 3 or 4 cusps, that means they have 4 lobes. The lingual lobes have fused, right? Lingual lobes are just fused, और कुछ नहीं है. Lingual lobes fuse हो गए, that's it. ठीक है? So mandibular first molar, permanent mandibular first molar, right? Permanent mandibular first molar. So this is the largest mandibular tooth, right? Largest mandibular tooth. और longest molar root कौन सी है? It is the mesial root of mandibular first molar. The mesial root of mandibular first molar is the longest molar root, right? मैंने आपको शेप के बारे में पहले ही बताया. कॉमन शेप तो हम क्या कहेंगे? पेंटागोनल, बिकॉज द डिस्टल कस्प इज लोकेटेड ऑन द डिस्टल सरफेस, नॉट ऑन द बकल सरफेस, राइट? जैसा कि मैंने आपको पहले ही बताया, बकल कस्प आर गाइड सपोर्टिंग कस्प एंड पैलेटल कस्प आर guiding cusp. So you can clearly see the palatal cusp from the buccal view because they are sharper, they are higher, right? They are sharper and they are higher as compared to the buccal cusps, right? तो अगर आपसे कोई पूछे कि कौन सी व्यू है, फ्रॉम विच व्यू अमंग्स दीज फोर, 1 2 3 4, है ना, 1 2 3 4, amongst these four views, in which of the following view will you be able to see all the 5 cusps? It will be buccal view. In the buccal view you can visualize all the 5 cusps, right? Second molar की बात करें तो it has larger root trunk but smaller roots, right? It has larger root trunk but smaller roots. The central groove is plus shaped and it is the most symmetric molar, right? It is the most symmetric molar. तो और कुछ है नहीं, it is made up of 4 lobes, right? Third molar again the roots are convergent, they may even fuse. यहाँ पर अगर ये 4 लोब से है तो 4 cusps हो सकते हैं, 5 लोब से है तो 5 cusps हो सकते हैं. Again the central groove is more or less plus shaped. It more commonly resembles the second molar as compared to the first molar, right? बाकी main features, most commonly impacted tooth, right? Most commonly impacted tooth. Most commonly missing tooth is maxillary third molar, right? Maxillary third molar is the most commonly missing, and mandibular third molar is most commonly impacted, right? Most variable morphology, again upper 8. Upper 8 most variable morphology, upper 8 की followed by lower 8 followed by upper lateral. Clear? तो इस तरीके से आप कुछ एक फीचर्स हैं जो कि थर्ड मोलर्स के बारे में इंटरेस्टिंग फैक्ट्स, ठीक है. तो मोस्ट कॉमनली मिसिंग तो कौन सा होगा, थर्ड मोलर. बट इवन अमंग्स द मैक्सिलरी एंड मैंडिबुलर थर्ड मोलर इट इज द मैक्सिलरी थर्ड मोलर व्हिच इज मोस्ट कॉमनली मिसिंग एंड मोस्ट कॉमन एंड मोस्ट वेरिएबल मॉर्फोलॉजी. द मोस्ट कॉमनली इंपैक्टेड वन इज द लोअर 8, राइट. तो ये कुछ परमानेंट टीथ के बारे में हमने बात की. अब कुछ अपन प्राइमरी टीथ के बारे में बात कर लेते हैं. हालांकि प्राइमरी टीथ में बहुत ज़्यादा कुछ नहीं है. तो प्राइमरी टीथ, इसमें जो मेन फीचर है, दिस लो अपर ए इज द ओनली एंटीरियर with mediodistal dimension greater than cervico-incisal dimension. This is the only anterior teeth, right, to have such a feature, and the upper central has most prominent and largest cingulum and lingual features of all the incisors. परमानेंट में लैटरल इंसाइजर में था, यहाँ पर सेंट्रल इंसाइजर में, मैक्सिलरी सेंट्रल इंसाइजर में. कनाइन्स में सेम फीचर, ठीक है. maxillary canine more prominent, all the features are more prominent as compared to the mandibular canine. Also the root length and the crown length is greater. यहाँ पर सभी फीचर्स maxillary canine में ही ग्रेट होंगे, चाहे वो crown length हो, चाहे root length हो, चाहे the entire tooth हो. all the lengths are greater in the maxillary canine. mandibular canine में जैसा mandibular molar में जैसा मैंने आपको कहा था, the mesial surface is almost flat, right? The mesial surface is almost flat, and the cervico-incisal or the cervico-occlusal dimension in the mandibular first molar is greater on the mesial half. mandibular second molar में जो 3 cusp हैं, they are not mesiobuccal, distobuccal and distal. They are rather mesiobuccal, buccal and distobuccal, and all these cusps are of almost same size. So the variation in the size of the cusp is less in primary as compared to the permanent. Variation of cusp size प्राइमरी में परमानेंट से कम है, ठीक है. मैंडिबुलर मोलर्स, तो मैंडिबुलर मोलर्स दिस इज दी maxillary molar, this is the first molar and this is the second molar. Again the distal half is almost rudimentary, it is the mesial half that is more developed. बाकी हमने बात पीछे करी ली क्राउन साइजेस की. 2 to 3 years भावना, 2 to 3 years, परमानेंट में 2 to 3 years, प्राइमरी में 1.5 to 2 years, राइट. इन प्राइमरी में 1.5 to 2 years. सॉरी 1 to 1.5 years. इन प्राइमरी में रूट कंप्लीशन 1 to 1.5 years. In permanent 2 to 3 years, right? Just like permanent, we have the chronology for primary. थोड़ा सा ये भी देख लो and then we are done. तो initiation, all the primary teeth are initiated within the intrauterine life, and they are initiated between the 14th to 19th week of intrauterine life. So 14, 15, 16, 17, 18 and 19. तो अगर हम इसकी sequentially बात करें कि कैसे erupt हो रहे हैं या कैसे initiate हो रहे हैं, sorry not eruption, initiation. तो 14th week में तो incisors, कौन से? central incisors, right? So 14 में central incisor, 15 के अंदर कौन से initiate हो रहे हैं? 15 के अंदर इनिशिएट हो रहे हैं अपर एंड लोअर डी, 16 में अपर एंड लोअर बी, 17 अपर एंड लोअर कनाइन्स, 18 लोअर ई एंड 19 अपर ई, राइट? When the tooth erupts, approximately 2/3 of the root is formed. When the tooth reaches occlusion, approximately 3/4 root is formed. ठीक है, दोनों अलग अलग चीज है. कैसे? ये आपकी ओरल कैविटी है, ये मैक्सिला है, ये मैंडिबल है. When the tooth first penetrates the oral cavity, right? So let's say this is the canine and it has just penetrated the oral cavity. At this time, approximately 2/3 root is formed. But when this canine reaches occlusion, right? When this canine reaches occlusion, तो इसी को मैं थोड़ा सा पीछे की तरफ करके बता रहा हूँ. ये let's say this canine now has reached occlusion with the opposing canine, right? It has reached occlusion. It has established occlusion with the opposing canine. Now approximately 3/4 root is formed. So both the options are correct depending on the question. So if they ask you the amount of root formed when the tooth has reached occlusion, it is 3/4. When they ask you the amount of root formed when the tooth first penetrates or first erupts into the oral cavity, it is 2/3 of the root, right? तो हमने इनिशिएशन की बात की, प्राइमरीज की 14, 15, 16, 17, 18 एंड 19. सबसे पहले लेंटरल इंसाइजर, देन फर्स्ट मोलर विल इनिशिएट, देन लैटरल, देन कनाइन, देन मैंडिबुलर सेकंड मोलर, देन मैक्सिलरी सेकंड मोलर, राइट? फिर हम उसके बाद क्राउन कंप्लीशन की बात करते हैं. तो क्राउन कंप्लीशन में कैसे होगा? दे विल कंप्लीट इन मंथ्स, राइट? दे विल कंप्लीट इन मंथ्स आफ्टर बर्थ. सो crown is completed after birth, that's why they have neonatal line, isn't it? तो birth से पहले तो complete नहीं हो सकता, वरना neonatal line होती ही नहीं. It completes after birth, that's why neonatal line. So months after birth. So जब हम completion की बात करते हैं तो हम बात करते हैं 1.5 या 1, 2, 3, 6, 9 and 6, 9, 10, 11. इस तरीके से हम याद रख सकते हैं. सबसे पहले वो वाला टूथ कंप्लीट होगा जो सबसे पहले इनिशिएट हुआ है, तो इंसाइजर, दैट इज सेंट्रल इंसाइजर, at the age of 1.5 to 2.5 years, right? 1.5 to 2.5 central incisor, then maxillolateral incisor at 2.5, mandibular incisor approximately 3 years, then the tooth that initiated second, that is first molar, वो next complete होगा. तो 6 years, sorry 6 months of age, मैं years अगर बोला हूँ तो प्लीज उसे months ही माने, क्योंकि क्राउन जो है मंथ्स में कंप्लीट होता है. तो 6 मंथ्स में अप्रोक्सीमेटली फर्स्ट मोलर कंप्लीट हो जाएगा, और फिर उसके बाद 9, 10, 11 मंथ्स ऑफ एज में रिमेनिंग टीथ हमारे कंप्लीट हो जाएंगे. तो 9 मंथ्स ऑफ एज पे अपर कनाइन एंड लोअर कनाइन, 10 मंथ्स ऑफ एज पे लोअर सेकंड मोलर एंड 11 पे अपर सेकंड मोलर, राइट? 10 पे लोअर सेकंड मोलर, 11 पे अपर सेकंड मोलर, राइट? तो 1.5, 2.5 and 3 years for central, lateral and D, that is first molar. उसके बाद 9, 10, 11, 9 पे canine, 10 पे lower second molar, 11 पे अपर सेकेंड मोलर। फिर उसके बाद इरप्शन। अब इरप्शन की डेट्स जो हैं पहले तो अलग होती थी। अगर आप व्हीलर्स का ही मेरे ख्याल से सिक्स्थ या सेवेंथ एडिशन अगर आप पढ़ेंगे तो उसमें आपको मैंडिबुलर कनाइंस की, मैंडिबुलर जो ये डेसिड्यूस है इनकी आपको मिलेगी 6, 7, 16, 12, 20, राइट। बट इन रिसेंट एडिशंस दे हैव चेंज्ड दीज डेट्स, क्योंकि अब बच्चों के दांत लेट इरप्ट हो। बट दैट डज नॉट मीन दैट द रूट इरप्शन रूट कंप्लीशन डेट्स हैव चेंज्ड, राइट। आप इस 6 में 1 ऐड करोगे, जैसे मैंने बताया आपको डेसिडुअस में 1 to 1.5 ऐड करना है to get the root completion dates, right? So if you add 1 to 6, you will get 1.5 years, right? So it still is valid. That old eruption sequence 6, 7, 16, 12, 20 mandible की is still valid to calculate the root completion dates, right? बट रिसेंट में अगर हम देखें तो सबसे पहले तो कौन सा इरप्ट होगा? लोअर सेंट्रल। लोअर सेंट्रल के बाद अपर सेंट्रल एट द एज ऑफ 10 मंथ्स, राइट। फिर उसके बाद अपर लैटरल। तो पहले लोअर सेंट्रल, then upper central, then upper lateral, and after that you will have the lower lateral at the age of approximately 1 year, that is 13 months, right. इसके बाद incisors के बाद first molars at the age of 16 months, both at the age of 16 months, then canine at 19 months, and at approximately 2.5 years of age, second molars will erupt. So at approximately 2.5 years, second molars will erupt. So initially इनकी इरप्शन डेट अलग थी, 6, 7, 16, 12, 20, जैसा मैंने आपको मैंडिबल के वाले बताया, और मैक्सिला में थी 7, 8, 18, 14, 24। सो इनिशियली दे वर कॉल्ड 2 years teeth, राइट। 24 यानी 2 years tooth, राइट। So initially the second molars were called 2 years teeth, but now as you can see 2.5 years पे erupt हो रहे हैं, right? So eruption dates have changed, but as you can see that the root completion dates are still calculated from the older dates. तो जो older eruption date थी उसके हिसाब से कैलकुलेट हो रहा है। तो क्या मतलब हुआ? केवल eruption डिले हुआ है, रूट फॉर्म मतलब टूथ फॉर्मेशन जो है वो डिले नहीं हो रहा है। So that there is a delay in the eruption of primary teeth, but there is no delay in the formation of primary teeth. Is it clear? ठीक है। तो ये कुछ एक पॉइंट्स है जो मैंने आपके लिए लिखे हुए। मैक्सिलरी इंसाइजर्स जो होते हैं उनके क्राउन मैंडिबुलर इंसाइजर से पहले कंप्लीट होते हैं, बट जो पोस्टीरियर्स हैं वो मैंडिबुलर पहले कंप्लीट होते हैं, ठीक है। एंटीरियर्स मैक्सिलरी विल कंप्लीट बिफोर मैंडिबुलर, एंड पोस्टीरियर्स मैंडिबुलर विल कंप्लीट बिफोर मैक्सिलरी। सिमिलरली जब हमने इरप्शन की बात की तो हमने परमानेंट के अंदर 2 एक्सेप्शन पढ़े थे। प्रीमोलर्स जो कि मैक्सिला में पहले इरप्ट होते हैं मैंडिबल के कंपैरिजन में, और यहाँ पर वो कौन से दांत हैं? लैटरल इंसाइजर एंड कनाइन, जो कि मैक्सिला में पहले इरप्ट हो रहे हैं मैंडिबल के कंपैरिजन में, राइट। तो 2 दांत परमानेंट में और 2 दांत प्राइमरी में मैंडिबल से पहले मैक्सिला में आते हैं। परमानेंट में प्रीमोलर्स हैं, प्राइमरी में कनाइन और लैटरल इंसाइजर है, राइट। तो ये तो बस ये कि अप्रोक्सीमेटली एट द एज ऑफ 3 to 3.5 years जो है canines की रूट एस्टैब्लिश हो जाती है। इट इज देन वी से दैट द प्राइमरी डेंटिशन हैज एस्टैब्लिश्ड, राइट। सो दिस वाज ऑल अबाउट द DADH। अगर कुछ पूछना हो तो आप पूछ सकते हैं। अगर आपको कुछ पूछना हो तो आप पूछ सकते हैं, नहीं तो सेकंड सेशन जिनका भी है वो स्टार्ट कर लेंगे। डन। परसों के एग्जाम के लिए ऑल द बेस्ट, एंड प्लीज स्टे काम, रीड द क्वेश्चन प्रॉपरली एंड कंप्लीटली, ठीक है। ट्राई टू ट्रांसलेट इट। Histological pics, I have some, but I have shown it in previous sessions. Just a minute. I'll get some histological slides for you. So here is a histological slide. So here is a histological slide and even a MCQ based on the slide, right? So identify the difference between the two images, right? You have to identify the differences between the two images. This is the image A, this is the image B. Certain options are given. Now, the thing is, हेलो भाई, यहाँ बच्चे कुछ हिस्टोलॉजिकल डायग्राम्स दिखाने के लिए बोलते है ना, मेरे ख्याल से 5-10 मिनट और, ठीक है। तो यहाँ जैसा कि आप देख रहे हैं, ये दोनों ही इनामल है, राइट? बोथ दीज आर इनामल्स सिंस यू डू नॉट सी एनी hollow tubes here. This is not dentine, this is enamel. The only difference is in the pattern. The only difference is in the pattern. This is pattern 3 and this is pattern 1, right? This is pattern 3 and this is pattern 1 enamel. Clear? Pattern 1 enamel में क्या है? All the circular enamel rods are seen. Whereas in the pattern 3, you will see the classic keyhole structure, right? The classic keyhole structure is seen in pattern 1 and these are the common enamel rod patterns seen in the human dentition. तो ये क्वेश्चन आ सकता है, मेजॉरिटी तो टाइप 3 होगी बट समटाइम्स टाइप 1 इज ऑल्सो सीन, राइट? नेक्स्ट क्वेश्चन जैसे ये है, व्हाट डू यू सी इन दिस डायग्राम? अगेन दिस इज अ डायग्राम ऑफ इनामल, अगेन दिस इज अ डायग्राम ऑफ इनामल। पर यहाँ पर हमें क्या फीचर देखने को मिल रहा है? एज यू कैन सी यहाँ पर ये इनामल रॉड्स जो है पूरी कर्व हो रही है, राइट? ऑल दीज इनामल रॉड्स आर गेटिंग कर्व, they are running in all half z direction, isn't it? So what is this feature? This is gnarled enamel, isn't it? This is gnarled enamel. दिखने को और भी कुछ दिख रहा है, जैसे क्रैक भी है इधर, राइट? क्रैक है यहाँ पर क्रैक है, राइट? एंड यू कैन सी डेंटिन हियर, बट मेजॉरिटी ऑफ डायग्राम कहाँ फोकस्ड है? इधर। इतना बड़ा फीचर ये दिख रहा है। तो अगर आपसे पूछेंगे क्या फीचर आपको दिख रहा है, तो अपन एक छोटे से फीचर की बात नहीं करेंगे, हम एक बड़े फीचर की बात करेंगे। प्लस the options will help you, right? Enamel rod, enamel lamellae, HS bands, gnarled enamel. तो gnarled enamel, क्योंकि इसमें क्रैक्स वगैरह किसी भी चीज की बात हो ही नहीं, राइट? नेक्स्ट अगेन दिस इज फ्रॉम एनामल। तो यहाँ पर हमने क्या देखा है? स्ट्राई ऑफ रेड्जियस। स्ट्राई ऑफ रेड्जियस मैंने आपको पीछे डिस्कस करते वक्त ही बताया, वीकली इंक्रीमेंटल लाइंस हैं, सो दे डू नॉट रन in straight as straight lines from DEJ to surface, right? They are seen as oblique lines. They are seen as oblique lines from DEJ to surface. So these oblique lines are nothing but the incremental lines of Ridgius, right? और जैसा कि ये मूव कर रही है, जिस डायरेक्शन से मूव कर रही है, DEJ से ऊपर की तरफ जहां मूव कर रही है, this denotes the occlusal surface, right? They will all move towards the occlusal surface, ठीक है? तो इसको देख करके आप occlusal surface का भी अंदाजा लगा सकते हैं। डी जैसे स्टार्ट होकर के जिस डायरेक्शन में मूव कर रही है, दिस डायरेक्शन पॉइंट्स टुवर्ड्स द ओक्लूजल सरफेस, राइट? ये केरीज है, तो दीज आर नॉट हंटर शेगर बैंड्स बिकॉज हंटर शेगर बैंड्स वुड बी सीन ऑन द इनर 4/5, राइट? दे वुड बी सीन इन द इनर 4/5, बट केरीज स्टार्ट्स फ्रॉम द आउटर सरफेस एंड दैट्स व्हाई दिस decalcification represents caries and not hunter शेगर बैंड। यहाँ पर ये क्रॉस सेक्शन है प्रीमोलर का, राइट? और आपको ये बटरफ्लाई शेप स्ट्रक्चर दिख रहा होगा, बटरफ्लाई शेप फीचर, दिस इज नोन एज स्क्लेरोटिक डेंटिन। सो स्क्लेरोटिक डेंटिन कॉमनली रूट पर कहाँ मिलेगा? on the proximal walls, right? On the proximal walls, right? This is the sclerotic dentin. It is commonly seen on the proximal walls of the root. ये क्या है? हमने अभी सर्कमपल्पल डेंटिन में बात की थी कि हमें इंटरग्लोब्यूलर डेंटिन मिलता है. तो बेसिकली डेंटिन का क्लासिफिकेशन कैसा है? ग्लोब्यूल्स, 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 बहुत सारे ग्लोब्यूल्स. These will enlarge and they will coalesce to mineralize the dentin. But if the area between these globules remains unmineralized, right, then it will appear angular as is seen here, isn't it? And this is the interglobular dentin. This is the unmineralized dentin, right? Unmineralized dentin, and is seen close to the surface, right? अब यहाँ पर हमें क्या देखना है कि आपको तीन फीचर्स दिख रहे हैं इसमें डायग्राम में अलग अलग. तो मे बी यू नीड टू आइडेंटिफाई द प्री डेंटिन. तो प्री डेंटिन आइडेंटिफाई करने बोल रहे हैं. So this is the pulp, as you can identify it from the rich cell seen here, right? This is the dentin just above the pulp, and this is dentin away from the pulp. तो जो dentin pulp के पास होगा वही तो unmineralized होगा. So this is the pre-dentin, right? And this is the dentin, that is mineralized dentin. So mineralized dentin जो है, it will appear more eosinophilic, right? It will appear darker as compared to the pre-dentin. So what do you see here? These dark features. This is the dead tract. So dead tract will appear dark, and sclerotic dentin will appear light, right? They will appear lighter, whereas the dead tracts will appear darker. तो डार्कर कब दिखेंगे और लाइटर कब दिखेंगे? तो डेड ट्रैक्ट पर दिखेंगे डार्क इन दी ट्रांसमिटेड लाइट, राइट? बट दे विल अपीयर लाइट इन दी रिफ्लेक्टेड लाइट. तो रिफ्लेक्टेड लाइट में तो ये हमको व्हाइट या लाइटर दिखेंगे, और ट्रांसमिटेड लाइट में ये हमको डार्क दिखेंगे. इसका एग्जैक्टली अपोजिट स्क्लेरोटिक डेंटिन का होगा. ट्रांसमिटेड लाइट में स्क्लेरोटिक डेंटिन लाइट दिखेगा, रिफ्लेक्टेड लाइट में डार्क दिखेगा. क्लियर है? दिस इज अगेन अनदर फीचर फ्रॉम डेंटल हिस्टोलॉजी. इसमें हमने क्या कहा है कि आइडेंटिफाई दी फीचर्स मार्क्ड बाय द एरो. यहाँ पर आपको कुछ एरोस दिख रहे हैं, दे आर मार्किंग सम फीचर्स, सो यू नीड टू आइडेंटिफाई दोस फीचर्स. अब यहाँ पर हमें क्या दिख रहा है? अंदर की तरफ हमें बहुत सारी लाइंस 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 दिख रही है, ठीक है? और बाहर की तरफ हमें यहाँ पर थोड़ी बोन दिख रही है, थोड़ा सॉफ्ट टिश्यू दिख रहा है. तो व्हाट इट मीन्स इज, यहाँ तो है टूथ और यहाँ है पीडीएल, तो बीच में क्या हो गया? सीमेंटम, राइट? तो फीचर्स मार्क्ड बाय द एरो, you can see certain lines running through the cementum. So what are these lines? These are the incremental lines which are seen in cementum. So incremental lines cementum को क्या कहते हैं? Incremental lines of Salter. ठीक है? तो feature marked by arrow बोला है. अगर ये बोलता है tissue marked by arrow, then we would have gone with cementum. Since it has asked for feature, we have gone with incremental lines of Salter. ठीक है? तो क्वेश्चन को ढंग से पढ़ना जरूरी है. अगर इसमें फीचर की जगह सेम क्वेश्चन में सेम एरो, नथिंग चेंज, if I substitute this feature with the tissue, then the answer will become cementum, right? ऐसे यहाँ पर हम क्या देख रहे हैं कि ये एक टिश्यू बना हुआ है इधर, एंड दे आर आस्किंग व्हाट इज इट. तो ये अंदर आपको डेंटिन दिख रहा है, बाहर अगेन आपको बोन दिख रही है, ठीक है? तो दैट मीन्स दिस इज सीमेंटम. तो ये सीमेंटम है, रिपेयर हो रहा है. तो ये रेपरेटिव सीमेंटम है. कौन सी सीमेंटम है ये? रेपरेटिव सीमेंटम. तो इसका मतलब यहाँ पर क्या हो रहा है? कौन सा प्रोसेस चल रहा है? इधर सीमेंटम रिपेयर चल रहा है, ठीक है? ऑल्सो क्योंकि ये आपको इनफिलिंग दिख रही है सीमेंटम की रूट के अंदर, तो यू कैन क्लियरली से दैट दिस इज सेल्यूलर इंट्रिंसिक फाइबर सीमेंटम. तो जब भी एनाटॉमिकल रिपेयर होती है रूट की, जब रूट के अंदर जो कॉन्कैविटी बन जाती है उसमें फिलिंग होती है सीमेंटम की, दैट इज ऑलवेज फिल्ड विद सेल्यूलर इंट्रिंसिक सीमेंटम, राइट? ये कुछ एपिथेलियम में से है. तो एपिथेलियम में जैसे क्या आप इन दोनों को डिफरेंशिएट कर सकते हो? इसमें ऑर्थोकेराटिनाइज कौन सा है, पैराकेराटिनाइज कौन सा है? तो ऑर्थोकेराटिनाइज में तो हमेशा क्या होगा? जो आउटर केराटिन लेयर है it will not show any organelles, neither it will show any nucleus, right? तो यहाँ पर आप देख रहे हो ना तो कोई न्यूक्लियस दिख रहा है, ना ही कोई और ऑर्गेनेल्स दिख रहा है। यहाँ पर हमें छोटे 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 ये ब्लैक ब्लैक डॉट्स दिख रहे हैं, दैट मीन्स यू हैव न्यूक्लियाई हियर। ऑल्सो यू कैन सी दीज सेल्स, स्ट्रैटम ग्रेन्युलोसम सेल्स। यहाँ पर आपको ग्रैन्यूल्स दिख रहे हैं ना, ग्रैन्यूल्स। यहाँ पर आपको ग्रैन्यूल्स भी दिख रहे हैं, यहाँ पर भी दिख रहे हैं आपको ग्रैन्यूल्स, राइट? दिख रहे हैं ना यहाँ ग्रैन्यूल्स, जस्ट लाइक हियर। तो ऐसे ही ग्रैन्यूल्स आपको यहाँ भी दिख रहे हैं। डिफरेंस क्या है? केवल यहाँ ग्रैन्यूल्स है, यहाँ ग्रैन्यूल्स है, यहाँ न्यूक्लियस नहीं है, यहाँ न्यूक्लियस है। So when you have stratum granulosum with nucleus, that is parakeratinized. When you have stratum granulosum without nucleus, that is orthokeratinized. So this is ortho, this is parakeratinized. Clear? और ये एपिथेलियम कौन सी है? यहाँ पर आपको सरफेस तक कोई केराटिन की लेयर नहीं दिख रही है, यहाँ पर आपको प्रॉपर सेल्स दिख रहे हैं। सो दिस इज नॉन केराटिनाइज्ड, right? This is non-keratinized. Now what is this? What do you see here? तो सबसे पहले तो हम यहाँ देखेंगे कि हम यहाँ पर 2, 3 और 4 जोन्स इजीली डिफरेंशिएट कर सकते हैं। अगर हम ऑप्शंस देखेंगे तो हमें और समझ में आ जाएगा कि ये क्या चीज है, राइट? इंट्रा-आर्टिकुलर डिस्क, फाइब्रोकार्टिलेज ऑन कॉन्डाइल, नॉन केराटिनाइज्ड एपिथेलियम एंड एंडोकॉन्ड्रल बोन। तो एंडोकॉन्ड्रल बोन नहीं है ना? क्यों नहीं है? क्योंकि बोन तो यस यहाँ पर है, कार्टिलेज भी है, बट ऊपर फाइब्रस लेयर भी है और इधर सेल्यूलर प्रोलिफरेटिव लेयर भी है। एंडोकॉन्ड्रल बोन में हमें इतना कुछ नहीं दिखेगा, राइट? नॉन केराटिनाइज्ड एपिथेलियम ये नहीं है क्योंकि यहाँ पर कार्टिलेज दिख रहा है। फाइब्रो कार्टिलेज ऑन दी कॉन्डाइल, यस, फाइब्रो कार्टिलेज जो है कॉन्डाइल के ऊपर या आर्टिकुलर सरफेस ऑफ ग्लिग्नोइड फोसा, वहां पर यही स्ट्रक्चर दिखता है, आउटर मोस्ट फाइब्रस लेयर। ठीक है, तो आउटर मोस्ट तो फाइब्रस लेयर हो गई। यहाँ पर आपको सेल्स कम दिख रहे हैं, दिख रहा है? छोटे छोटे सेल्स हैं, कम है। फिर नीचे आप देखो छोटे 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 बहुत सारे सेल्स हैं, तो सेल्यूलर प्रोलिफरेशन हो रहा है। तो यहाँ पर क्या हो रहा है? प्रोलिफरेशन। ठीक है, तो यहाँ पर हमें क्या देखेंगे? सीमेंटोब्लास्ट, सॉरी कॉन्ड्रोब्लास्ट, नॉट सीमेंटोब्लास्ट, कॉन्ड्रोब्लास्ट। यहाँ क्या दिखेंगे हमें? कॉन्ड्रोब्लास्ट, एक्टिवली डिवाइडिंग सेल, कॉन्ड्रोब्लास्ट दिख रहा है। यहाँ पर क्या हो रहा है? These chondroblasts are enlarging, hypertrophy, zone of hypertrophy. तो जहां zone of hypertrophy, that is size is increasing, number is not increasing. तो साइज बड़ा हो गया। यहाँ पर आप देख रहे हो छोटे सेल्स हैं, यहाँ बड़े सेल्स हैं, तो साइज बड़ा हो गया। तो दिस इज जोन ऑफ हाइपरट्रोफी। जोन ऑफ हाइपरट्रोफी में क्या दिखेगा? कॉन्ड्रोब्लास्ट या कॉन्ड्रोसाइट? इट विल बी कॉन्ड्रोसाइट। सो ये सेल जो है यहाँ पर ब्लास्ट से बड़ा साइट सेल है। ठीक है, और सबसे नीचे हमें क्या दिख रहा है? जोन ऑफ कैल्सिफिकेशन। यहाँ पर जो आपका कार्टिलेज ये बन रहा है, दिस गेट्स कैल्सिफाइड हियर, राइट? सो दिस इज द फाइब्रोकार्टिलेज ऑन द कॉन्डाइल। ये टिपिकल फीचर है फाइब्रोकार्टिलेज का। सबसे बाहर फाइब्रस लेयर, इसके अंदर जो कोलेजन है वो क्रिम्पी होता है। कैसा होता है कोलेजन? क्रिम्पी। ठीक है, तो ये कुछ फीचर्स हैं जो आपको इसको आइडेंटिफाई करने में हेल्प करेंगे। नाउ म्यूकस वर्सेस सीरस ग्लैंड्स। अब ये म्यूकस ग्लैंड है या सीरस ग्लैंड है, तो इसको देखो और कंपेयर करो। ठीक है, ऊपर वाले लेयर को नीचे वाले लेयर के साथ कंपेयर करो, तो आपको क्या दिख रहा है? कहां पर ऐसा हो रहा है कि म्यूकस जो है दैट इज पुशिंग द न्यूक्लियस टुवर्ड्स द पेरिफेरी। एक तरफ तो ये न्यूक्लियस है जो कि पेरिफेरी की तरफ पुश हो रहा है, एक तरफ न्यूक्लियस आपको प्रॉपर राउंड दिख रहा है। ठीक है, सो देयर इज नो प्रेशर ऑन द न्यूक्लियस एट वन प्लेस, whereas the nucleus is pushed to the periphery and appears flattened, right? The nucleus appears flattened. तो जहां भी म्यूकस बनेगा वो म्यूकस मोर और लेस सारा इंटरसेल्यूलर एरिया ऑक्यूपाई कर लेगा, इंटरसेल्यूलर एरिया, और न्यूक्लियस को कंप्रेस कर देगा। ठीक है, तो यहाँ पर तो क्या दिख रहा है हमें? न्यूक्लियस कंप्रेस्ड है, पेरिफेरी पे लोकेटेड है न्यूक्लियस, एंड देयर इज म्यूकस ऑल अराउंड, सो दिस इज द म्यूकस सेल्स। और यहाँ पर हमें क्या दिख रहा है? जो न्यूक्लियस है दे आर राउंड। अगर और कुछ नहीं भी समझ में आए ना, राउंड न्यूक्लियस दिख जाए तो भी आप कह सकते हो आराम से कि ये सीरस सेल्स हैं। ठीक है, उसके अलावा आपको यहाँ पर छोटे 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 डॉट्स 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 दिखेंगे ये, क्योंकि ये लेस मैग्निफिकेशन है। ठीक है ना, ये मैग्निफिकेशन उतना ज्यादा नहीं है, हाई मैग्निफिकेशन में नहीं देख रहे, लो मैग्निफिकेशन में देख रहे हैं। तो यहाँ पर जाइमोजन ग्रेन्यूल्स होते हैं, जो आपका सेल है इसके अंदर नीचे तो न्यूक्लियस है और ऊपर जाइमोजन ग्रेन्यूल्स होते हैं। तो these zymogen granules are nothing but secretory organelles. तो ये हमें ऐसे डॉटेड फॉर्म्स में देखते हैं. तो अगेन दिस हेल्प्स टू आइडेंटिफाई द serous cell, right? आइडेंटिफाई द स्टेज ऑफ टूथ डेवलपमेंट. तो यहाँ पर आपको प्रॉपर टूथ का फॉर्म दिख रहा है कि इंसाइजर या कनाइन कुछ तो भी है. सो यू कैन इजीली से दिस इज द लेट बेल स्टेज. जहां भी टूथ का प्रॉपर फॉर्म दिख जाए, लेट बेल. कैप कैसा दिखेगा हमें? एक तो कैप इस तरीके से थोड़ा शैलो दिखेगा, दूसरा कैप के साथ ही एक लेटरल लेमाइना अटैच होगी. यहाँ पर आपको ऊपर कोई इसकी स्टॉक ऐसे अटैच नहीं दिख रही ना, तो दैट्स वाई दिस इज बेल स्टेज. प्रॉपर टूथ शेप दिख रही है तो दैट मीन्स लेट बेल स्टेज. और जैसा कि आप यहाँ पर थोड़ा और ध्यान दोगे तो आपको पता चलेगा कि इसमें हार्ड टिश्यू फॉर्मेशन भी दिख रही है, जो कि ब्लू और रेड कलर्स में दिखा रखी है, राइट? So this is diagram I have taken to explain the different theories used to explain the hypersensitivity of dentine. तो hypersensitivity के लिए कौन कौन सी theories यूज करी थी एक्सप्लेन करने के लिए? एक तरफ तो ये हाइड्रोडायनेमिक थ्योरी है, जहाँ की वाटर का मूवमेंट हो रहा है अप एंड डाउन. दूसरी तरफ ये ट्रांसडक्शन थ्योरी है, जो कहती है कि ओडोंटोब्लास्ट और ओडोंटोब्लास्ट के थ्रू नर्व, ठीक है. और एक तीसरी है जो डायरेक्ट नर्व कंडक्शन, कि नर्व्स एक्सटेंड टुवर्ड्स दी DEJ and they directly conduct the impulse to the nerves. ठीक है. तो both of these, that is transduction and direct nerve conduction theories, are rejected. The hydrodynamic theory is accepted, but the question is not which one is accepted and which is rejected. It is which of these represent a theory that has been proposed to explain dentine hypersensitivity. ठीक है. तो प्रपोज तो तीनों ही की थी. तो अगर हम क्वेश्चन की लैंग्वेज पे जाएं तो इसमें आंसर होना चाहिए ऑल ऑफ दी अबव, इजंट इट? ऑल ऑफ दी अबव, क्योंकि ये तीनों ही प्रपोजल की गई थी एक्सप्लेन करने के लिए. अभी किससे सही हुआ किससे गलत हुआ वो डिफरेंट मैटर है, वो क्वेश्चन में नहीं पूछा है. तो हमें क्वेश्चन की लैंग्वेज ढंग से पढ़ना समझना जरूरी है, राइट? अब ये क्या है? ग्राउंड सेक्शन है एक पुराने टूथ के सरफेस का, माइक्रोस्कोप में देख रहे हैं अपन. तो हमें क्या बताना है? पोजीशन ऑफ दी पोजीशन दैट इज पॉइंटेड बाय द एरो. अब यहाँ पर क्या दिख रहा है? सीमेंटोसाइट्स और इसके एक्सटेंशन सेल्यूलर एक्सटेंशन. तो सेल्स विल ऑलवेज सेंड देयर एक्सटेंशन टुवर्ड्स द ब्लड सप्लाई, क्योंकि न्यूट्रिशन चाहिए. और ब्लड सप्लाई किधर मिलेगा? PDL की तरफ, है ना? डेंटिन में तो ब्लड सप्लाई मिलेगी नहीं, PDL में मिलेगी. तो टुवर्ड्स द रूट सरफेस, राइट? नॉट टुवर्ड्स द डेंटिन और नॉट टुवर्ड्स द पल्प. क्लियर? अब इस तरीके से एक ये डायग्राम है कि इसमें ये जो सर्कल्स हैं, ये जो छेद हैं, ये क्या रिप्रेजेंट कर रहे हैं? व्हाट आर दीज होल्स ऑन द लिंगुअल सरफेस ऑफ डेसिडुअस टीथ? ये प्राइमरी टीथ हैं. तो प्राइमरी टीथ और परमानेंट टीथ, दे वर वंस इन द सेम बोनी क्रिप्ट, राइट? दे स्टार्टेड टू फॉर्म इन द सेम बोनी क्रिप्ट. एक्चुअली नितिन सर आपका ऑलरेडी वेट कर रहे हैं, इसलिए हम थोड़ा सा फास्ट कर रहे हैं, राइट? दे वर वंस इन द सेम बोनी क्रिप्ट, बट लेटर ऑन क्या हुआ कि ये जो प्राइमरी ये अपनी बोनी क्रिप्ट में चला गया, एंड देयर वाज अ कनेक्शन बिटवीन द बोनी क्रिप्ट्स ऑफ प्राइमरी एंड परमानेंट. So these holes represent the connection between primary and permanent bony crypts. तो इसको हम कहते हैं governacular canal, ठीक है? governacular canal. And these are seen only associated with primary teeth, succedaneous teeth जहाँ होंगे वहीं पर, ठीक है? molars, permanent molars के साथ ये हमें holes नहीं मिलेंगे. Identify the feature marked by the arrow. अब यहाँ पर जैसा कि आप देख रहे हो, ये फीचर देखो DEJ, इधर बाहर क्या है? इनामल, और अंदर ये बहुत ही बड़ा टिश्यू है, ठीक है ना? बहुत ही बड़ा टिश्यू है और ये बहुत सारी लाइंस है. ये क्या है? डेंटिनल ट्यूब्यूल्स. नाउ एज यू कैन सी देयर आर एट लीस्ट 3 ऑफ सच लाइंस, ठीक है? तो हमने पढ़ा है कि डेंटिनल ट्यूब्यूल जो है उसके अंदर एक कर्वेचर, मतलब 2 कर्वेचर होते हैं ना? एस शेप्ड है तो एक कर्वेचर ये हो गया, एक कर्वेचर ये हो गया. So had it been the primary bend of the dentinal tubules, there would have been only 2 bands. तो इसका मतलब प्राइमरी कर्वेचर तो ये नहीं है. तो प्राइमरी कर्वेचर नहीं तो फिर ये क्या है? जो डेंटिनल ट्यूब्यूल है along its length it has multiple secondary bends. तो ये secondary bends जब overlap करते हैं तो ये क्या बनाते हैं? von Ebner's lines बनाते हैं. And it is this von Ebner's lines which is seen here. ठीक है? यहाँ पर हमें क्या दिख रहा है? von Ebner's lines. Oh sorry, contour lines of oven. Please forgive me. जल्दबाजी के चक्कर में गलत नाम बोल दिया. कॉन्टूर लाइंस ऑफ ओवन, ठीक है? These are the contour lines of oven. These are the contour lines of oven, and they are formed by the overlap of secondary curvature of dentinal tubules. तो ये कुछ हिस्टोलॉजिकल डायग्राम्स थे. आई होप ये सफिशिएंट रहे होंगे. और कुछ पूछना है? Is there anything else? क्या लिखा है तुमने? ये पर मुझे समझ नहीं आ रहा है तुमने लिखा क्या है. Von Eppner's line, these are the weakly lines seen in the dentine. सॉरी, देखो डेंटिन जो है इसके अंदर एक तो मिलती है वॉन एबनर्स लाइन्स, दूसरी मिलती है एंडरसन्स लाइन्स, तीसरी होती है कॉन्टूर लाइन्स ऑफ ओवन. ठीक है. वॉन एबनर्स लाइन जस्ट लाइक दी क्रॉस स्ट्राइशंस, दीज आर दी डेली. एंडरसन्स लाइन्स वहां पर इनामल में थी स्ट्राई ऑफ रेडियस जो कि वीकली थे. दीज आर सीन एट 5 days interval. Anderson's lines. Contour lines of oven are unique to dentine and they are formed on the overlap of secondary curvature of dentinal tubule. ठीक है. इसके अलावा एक नियोनेटल लाइन इनामल में भी होती है, डेंटिन में भी होती है. तो नियोनेटल लाइन इज सिंपल, जब बर्थ होता है उस वक्त जो भी चेंजेस होते हैं बर्थ रिलेटेड, उसकी वजह से डेंटिन और इनामल में एक हमें प्रोमिनेंट लाइन दिखती है. इज इट क्लियर? डेंटल बर्ड क्या भी ठीक है. वॉन एबनर्स लाइन डेली लाइन जस्ट लाइक क्रॉस स्ट्राइशंस. एंडरसन्स लाइंस 5 day लाइंस. इनामल में स्ट्राई ऑफ रेडियस जो कि 7 day लाइंस होती हैं. कॉन्टूर ऑफ ओवन यूनिक टू डेंटिन जो कि ओवरलैप ऑफ सेकेंडरी कर्वेचर्स की वजह से बनती है. ठीक है. ये डेंटिन में ही होती है, इनामल में इसका कोई काउंटर पार्ट नहीं होता. नियोनेटल लाइन सीन बोथ इन इनामल एंड डेंटिन. कॉन्टूर लाइन ऑफ ओवन जैसा मैंने बताया ओवरलैप ऑफ सेकेंडरी कर्वेचर, बट अगर कोई हाइपोकैल्सिफिकेशन की वजह से भी लाइन बन रही है जैसे कि टर्नर्स टीथ में, तो भी हम उसे कॉन्टूर लाइन ऑफ ओवन कह सकते हैं. ठीक है. ओवरलैप सेकेंडरी होते हैं, बिल्कुल ओवरलैप सेकेंडरी कर्वेचर का होता है. प्राइमरी कर्वेचर का अगर ओवरलैप होगा तो उसे हंटर शेगर बैंड कहेंगे. एनामल में जैसे हमें हंटर शेगर बैंड दिखते हैं ना, सेम वैसे ही हमें डेंटिन में दो बैंड्स दिखते हैं, ब्रॉड बैंड्स, केवल दो. ठीक है. एंड दीज आर नोन एज हंटर शेगर बैंड, सेम एज इनामल. दे आर फॉर्म ड्यू टू ओवरलैप ऑफ प्राइमरी कर्वेचर. ठीक है. जो डेंटिनल ट्यूब्यूल्स का प्राइमरी कर्वेचर उसके ओवरलैप से बनता है, और सेकेंडरी कर्वेचर्स के ओवरलैप से बनता है कॉन्टूर लाइन ऑफ ओवन. क्या लिखा है तुमने? ये 2 लाइंस क्रॉस सेक्शनल से होते हैं न्यूनेटल. आई डोंट गेट व्हाट यू आर सेइंग. न्यूनेटल लाइंस सिंगल लाइन होती है, एनामल में भी एक ही लाइन होगी, डेंटिन में भी एक ही लाइन होगी. ठीक है. एंड इट रिप्रेजेंट्स दी tissue which is formed, or it differentiates the tissue which is formed before birth and after birth. तो डन. और कुछ नहीं. अब नितिन सर भी वेट कर रहे हैं, उनका फोन आ गया 2-3 बार, एक बार तो आपके सामने ही आ गया. ठीक है. अब मेरे ख्याल से नितिन सर को हम टाइम देते हैं. ठीक है ना. चलो, गुड बाय, ऑल दी बेस्ट. जब एग्जाम हो जाए तो बताना कैसा रहा.